I came across people reporting significant improvement, sometimes complete reversal in cases of multiple sclerosis, liver failure, diabetes, heart disease, emphysema, Parkinson. One day I received a paper, the title was Turning Blood into Brain. It was the first documentation of stem cell leaving the bone marrow and going to the brain and becoming a neuron in the brain. Neurologists will say, this is impossible because the brain does not repair. This is old data. If we define stem cells and their role, they are the repair system of the body. It's a reality that is hiding in plain sight. Intense physical activity will trigger significant stem cell release. We have lost more than 90% of our stem cells at some point in our lives. So that means there's a point where we start to accumulate deficits. What is the loss of cells making insulin? It's diabetes. What is the loss of cardiomyocytes? It's heart disease. What is the loss of neurons making dopamine? It's Parkinson. Every single tissue of the body is constantly to a process of tissue turnover, giving you a new skin every month, a new liver 2-3 years, half of a new heart every 25 to 50 years. It will take about 50 years to replace the heart. We have one participant in these studies that was with 13% ejection fraction. So he was on a heart transplant list, and they really did not believe that he would survive. In the meantime, he started to take some of these plant extract that act as stem cell mobilizers. They finally called him 3 months later. They had a heart. He drove himself to the hospital, climbed the stairs, walked in front of them, and they saw how he was. They canceled the surgery. Well, his ejection fraction was 48%. How can we make the human body live longer?
Join Disruptive Doctors.
I'm Dr. Selina, your host and co-founder of Disruptive Doctors. At Disruptive Doctors, we're building a platform to help doctors like you impact healthcare differently. In Post-Call, we dive into the untold stories of doctors who are breaking the mold, trailblazers who are redefining what it means to be a doctor. This is Post-Call Beyond the White Coat. Christian, your name is synonymous with cutting-edge research and stem cells, and it challenges the very foundation that we doctors have been taught. But before we dive into the science, I wanted to start with something very simple yet profound. For doctors and listeners who are tuning in, who might only know you as the author of Cracking the Stem Cell Code and a pioneer in stem cell research, what do they need to know about you? What is the core of your journey? And what has led you to focus on stem cell? Why has this become your life mission?
So my background is brain research. So I studied at the Montreal Neurological Institute, neurophysiology. I've never been a clinician, so all I have done is research. So at the time, my research was on epilepsy and memory. And at some point in that journey, academia was probably not, I was not working well in academia. And I was hired by the industry, by a company that was selling a dietary supplement at the time. It was blue-green algae from Klamath Lake. So it's a type of blue-green algae that grows naturally in a lake in Southern Oregon. And my role was to investigate the mechanisms of action and the active compounds for the health benefit of this blue-green algae. The reason was simply that in 1994, there's a new law that was passed in America, essentially forcing companies who were selling dietary supplements to have science to back up any of the claims that they would have about their product. So I was hired to essentially study and document what was the mechanism of action of that plant. The main benefits were on inflammation, on the immune system, and on mental clarity, a sort of sense of mental energy, mood elevation that a lot of people experience by taking this blue-green algae. So very quickly, we identified that this blue-green algae contains a polysaccharide that supports or stimulates various aspects of the immune system. It contains phycocyanin, which is the blue pigment in all blue-green algae, which is a very, very strong and potent COX-2 selective COX-2 inhibitor. And it contains phenylethylamine, that is known in chemistry as the molecule of love. There's a drug on the marketplace that is a derivative of PEA, phenylethylamine, which is Wellbutrin, which is an antidepressant. So when we can increase the amount of PEA in the brain, people have an experience of mood elevation, mental clarity. It was shown that a lot of people with attention deficit have a deficiency in PEA. So by identifying these compounds, we really explained the main benefits that people were experiencing. But as I'm doing this work, I came across people reporting significant improvement, sometimes complete reversal in cases of multiple sclerosis, liver failure, diabetes, heart disease, emphysema, Parkinson. Not only the results were impressive, but to me as a scientist, the biggest mystery was what was the plant doing to bring benefits touching so many different aspects of human health. So as we are engaged, and I'm engaged into this process in the very early days of stem cell research, at some point, some data made me believe that it looked like stem cells were the repair system of the body. And the question was, what if that plant, this blue-green algae, simply supports stem cells in the body, triggers the release of stem cells from the bone marrow? That means that with more stem cells, they would go into the pancreas of the diabetic, the liver of the liver patients, the lung of the emphysema patients, and so on. So we acquired a flow cytometer. We started to count stem cells in our blood, and we very, very quickly discovered that this plant was working as a stem cell mobilizer. So that's sort of the journey that led me to get into stem cell research.
Okay, maybe let's rewind a little bit. I just wanted to find out a little bit more. You saying that when patients started taking this blue-green algae, their symptoms, their MS, Parkinson, all started to get better. Were you all tracking that like intentionally, or were you looking for something else? Because how did you knew that it was stem cell, or was it just a strong hypothesis, a gut feeling that maybe it was stem cells?
When we made the observations, this was purely observational, meaning somebody would come to me and tell me, thank you, for what this product has done in my life. I used to have severe multiple sclerosis and now I'm fine. Of course, it's just a story. It has absolutely no medical value. But over the years, the number of those stories increased significantly, let's say 100. Some of them, I had access to their medical file. So some of them, we could see that it was real, but it was still just observation. It had no scientific value. But some of these cases really stayed with me and were telling me that it looked like this plant was doing something unusual. So we did a number of studies at different research centers trying to understand what was the mechanism of action. And it's one day when I received a paper, the title was Turning Blood into Brain. So I'm just trying to paint the picture here. This was not in the clinic. I was not dealing with patients. I was not even dealing in the lab at that point with individuals. I just have these people telling me these stories. And there's a point where, though they don't have a medical value, at the same time, when the number gets so significant and some of these people, I could see their medical record, it was clear that there was a very interesting improvement in the life or the condition of some of these people. So when I started to dig, example, at some point it was where the mid-1990s, and at the time, omega-3 fatty acids are sort of really coming forth on the marketplace. So they have been associated, omega-3 have been associated with heart disease or heart health, cardiovascular health, brain development. So I'm looking at the various benefits. So I'm thinking maybe blue-green algae is a great source of omega-3. So so we did a study with University of Harvard, and we discovered that indeed AFA is a very unique source of omega-3. The problem is that there's so little omega-3 that if at the end omega-3 were the active compounds, then a teaspoon or 2 tablespoons of flaxseed oil should give the same results. And we did not have the same thing with flaxseed oil. So I'm going to skip some step here, but the point is that we did various studies to try to understand what was the mechanism of action, and we found good data, but nothing at the end that really was solid to explain all these cases. Until one day I came across a paper. The title was Turning Blood into Brain. It was the first documentation, to my knowledge, of stem cell leaving the bone marrow and going to the brain and becoming a neuron in the brain. So we go back in 2001. Stem cells are known to be only precursors to blood cells. And of all organs in the body, we know that the brain does not repair. To this day, I'm talking sometimes to neurologists, and they will say, this is impossible because the brain does not repair. This is old data. We know today in the scientific literature, the nervous system can repair, the brain can repair. And we have an ongoing study that is showing that. We'll come back to that later. So, but in 2001, observing and documenting that a stem cell can go from the bone marrow to the brain and becoming a brain cell, I thought it was a breakthrough. So I went to the local medical library to see what else I could find. And I found another paper documenting stem cells going to the liver and becoming liver cells, and another one, stem cells going to the heart and becoming heart cells. So I simply started to think that if stem cells could become heart, brain, and liver, they must also be able to become other tissue and organs of the body. What could be the physiological process that would allow a stem cell to become brain, liver, and heart, but not skin, pancreas, lung, and the rest? Makes no sense. So we published an article suggesting that over time, we will discover stem cells can become many things in the body. And if that's the case, they have to be the repair system of the body. So we published this in a journal called Medical Hypotheses. The hypothesis that stem cells were the repair system of the body. And in the back of my mind, I started to have a new hypothesis. What if that blue-green algae was working by triggering the release of stem cells from the bone marrow? If indeed stem cells are the repair system, as they go, they will go to the pancreas of the diabetic, the heart of the heart patient, the liver of the liver patient, as the repair system. So we bought a flow cytometer to be able to test this hypothesis. And then we started on our cells. We started took a blood sample, counted the number of stem cells before and after consuming this blue-green algae, and we discovered the whole phenomenon, that this blue-green algae was triggering the release of stem cells from the bone.
Well, that is very interesting. I do have some stories of my own, which I have seen stem cells turning into corneal tissues. But I guess we'll go into that later. Before that, let's start with the very, very basics. Because like you mentioned, stem cells if I reflect back on my medical school and my medical training, I only know stem cells are in the bone marrow. They undergo hematopoiesis, and then they become blood cells. And that is
Correct.
all we've been taught in
Correct.
medical school. It was never really revisited. So let's talk about the foundation. What exactly are stem cells and what makes them so unique?
So stem cells, just like you described in what you have heard in medical school, and quite frankly, it is probably still what is taught right now in medical school. I don't think that there's a big training that goes beyond what has been traditionally known about stem cells, which is the fact that stem cells were known to be precursor cells capable of becoming platelet, white blood cells, and red blood cells. Some observations reported that they could also become tendon, ligaments, muscles, and bones, but it was really their limitation. So what is really the big discovery in the early 2000s that really led to this explosion in stem cell research is to realize that given the proper condition, stem cells can actually become pretty much everything in the body. I will go one step further. They've always become everything in the body. It's simply that if we don't have a tool to be able to mark the stem cell and then observe the transformation, the stem cells that you look at under the microscope today, tomorrow can be a liver cell, and you will have no signs telling you that yesterday it was a liver cell. So using histology, the process is completely invisible. And that is why it had never been seen truly. So it started to be revealed when basically sex mismatch bone marrow transplants started to be done, and also when dyes like for example, green fluorescent protein started to be developed. Green fluorescent protein was there in the 90s, but it got the Nobel Prize in 2008, and it's really around that time, early 2000, when it started to really be used a lot. And that's what revealed, basically, you inject GFP, green fluorescent protein, in a stem cell, you put that stem cells that's in the liver, and then you will see that you will have a whole population of liver cell. But if you shed a light, they start to glow green, telling you that all these liver cells were stem cells the day before. Otherwise, you cannot see the phenomenon.
Can you elaborate more on that mismatch of bone marrow transplant? Like what they found?
Well, the sex mismatch bone marrow transplant is simply that they do this in animals, but this also can be confirmed and was used to confirm the phenomenon in humans. And it is when a female mice or human is irradiated, or through chemotherapy, there is myeloablation. So we kill all the stem cells in the bone marrow and we do a bone marrow transplant from a male donor. So now all the stem cells in the bone marrow have the Y chromosome, and we can measure the Y chromosome. We can identify it. So that way we can see if stem cells are now leaving the bone marrow, going to various tissues. We can identify those cells, those somatic cells in the tissue that were stem cells before, because all the cells with a Y chromosome are originating from the bone marrow, from the bone marrow transplant. So it's a very simple process that is used to basically investigate the process of tissue repair, stem cell-based tissue repair.
What is the long-term effect of this mismatch, like sex mismatch transplant?
I am not really aware. I looked at this not long ago. I need to dig a little bit more into this, because over time, and this again has been shown, if you go back in women who have received bone marrow transplant from a male compatible donor, and you look at tissue biopsies taken at the time of autopsy, and you look at how many cells do we find in various tissues that have the Y chromosome, meaning the bone marrow stem cells that the woman has after the transplant start to go in various tissues and become cells of these tissues. And that was done to investigate a phenomenon tied to stem cells that I think is actually probably the most important of everything that has been done in the field of stem cell research, is that while stem cells participate to an acute injury in tissue repair, and with an acute injury, in the background, they simply replace the cells that are being lost, meaning every organ and tissues are constantly going through a process of tissue turnover. You're losing cells every day, and these cells are replaced by stem cells. That was seen in animals. So they use this process of sex mismatch, bone marrow transplant, to investigate, going and looking at these tissue biopsies in women, how many cells do we find 5, 10, 15 years after the bone marrow transplant in the heart, in the lung, in various tissues. And from there emerged the picture that in humans, this process of tissue turnover is taking place all the time. But what is the impact over time? Meaning, is the woman developing male traits? I don't think it has ever been really reported. We need to understand that a stem cell will be triggered to become cells of a specific tissue by specific markers in that tissue. So if a stem cell gets into the heart, it will be stimulated to become heart cells. So in a woman, you don't have male gonads, you don't have male tissues, so a stem cell will never be stimulated to become a male tissue. So it can become a male cell into an organ, but other than that, I don't think that hormonally there's really an impact. But it's a very interesting question that I need to look at a little bit more, because I think it would be fascinating if they indeed see a difference, after transplant, if a woman develops some male traits. I really don't know.
Yeah, because I remember learning about chimerism during medical school. So
Correct.
I was just curious if this is what could trigger chimerism.
I mean, you see chimerism naturally to a much lesser extent, but you see it with stem cells sometimes from a son, from a newborn that escapes and gets into the mother's blood. And then you do find some bone marrow colonies, if you want, that carry the Y chromosome. So, and we don't see these mothers developing male characteristics. So my assumption right now would be that it's not really something that is being seen, because chimerism is a known phenomenon.
Okay, so what is the role of a stem cell or stem cells in general in our bodies?
Stem cells were believed to be precursors of blood cells. So that is one of their main roles. These are hematopoietic stem cells. It's still true, they're still precursors to blood cells. What is new in our understanding is that both hematopoietic stem cells, but also mesenchymal stem cells and other derivatives, other types of stem cells in the body, have the capability of becoming virtually everything in the body. And that includes the heart, that includes the brain, different types of stem cells, and we can dive into this if you want. Different types of stem cells have more capabilities than others, but generally speaking, if we define stem cells and their role, they are the repair system of the body. If there's an injury, the injury will release like a heart attack, a stroke, a broken bone, burn to the skin, whatever the injury. That area will trigger compounds that have been well identified that will go to the bone marrow, will trigger the release of stem cells from the bone marrow, then the affected area will release another set of compounds, one specifically stromal-derived factor 1, that will attract stem cells to that area. And when stem cells circulate in the fine capillaries of that area, they will be basically, it will trigger their migration into that tissue, where upon contact with cellular debris from that tissue, stem cells will proliferate and differentiate, transform into cells of that tissue. So what stem cells are? They are essentially the repair system of the body.
Well, that is actually one thing that we've not been taught. Like, there is a repair system in the body. I mean, yes, we do know cells generate, they go through mitosis, meiosis, and all of that. But the concept that your body is repairing itself is something that we were not taught. Yeah, so this is it really is shattering a lot of, it is practically shaking the foundations of what we were taught in medical school.
And to me, what I find amazing in this is that it is one of those things, it's a reality that is hiding in plain sight, because every single human being on this planet has seen that the body repairs. People have had broken bones, severe injuries, cuts, and we all witness that the body repairs. However, we know very well that most organs do not have intrinsically the ability to fully repair. So anytime an injury is significant, how did the body repair? And there's no answer. And basically, stem cell research is providing this answer. Stem cells are the repair system of the body. And what I'm saying here is extremely clear. The kind of study, for example, one study that we did, where we took female mice, we irradiated the female mice, injected stem cells with green fluorescent protein. So that means now all the bone marrow, the stem cells in the bone marrow are green. If we shed light on the bone marrow, the whole bone marrow will glow green. And then we triggered an injury to the muscle, to the tibialis muscle. And then we gave a control group, we gave, control, and the experimental group, we gave them an extract of that blue-green algae that we were working with at the time, to see if increasing the number of stem cells in circulation could accelerate the process of tissue repair. And what we could see 6 weeks later is that the entire muscle that was dead after the injection of cardiotoxin, 6 weeks later, the muscle is back, the leg has mobility, but the entire muscle is green, entirely green, meaning entirely derived from stem cells that came from the bone marrow.
Okay, before we dive into that, because I've got a few questions to ask regarding that, you coined this term endogenous stem cell mobilization. What does that mean, and how does that affect us? I know you mentioned that it repairs the tissue and all that, but what exactly is this term?
So I wanted to make the parallel with what most people know or think when we talk about stem cells, which is what for most people when we talk about stem cells is going to a lab and getting a stem cell injection. So oftentimes a stem cell injection, the stem cells will come, and that's where it varies from one clinic or one treatment to another. Stem cells can come from umbilical cord, but they can also come from your own bone marrow, your blood, your fat tissue, your follicles, dental pulp stem cells. There are now new stem cells are isolated from connective tissue. There are different sources for these stem cells. And then they are isolated, cultivated or not, and then re-injected in the bloodstream. And to me, what fascinated me from the early days of stem cell research, it is that these stem cells, they are already in the human body. They're not better, more regenerative because we take them out and put them back in. So what is then the natural role of stem cells in the body? And anytime you take a a blood sample, you can count stem cells in the blood, but their residence time in the blood is anywhere between 1 to 6 hours. So if they're always in the blood with a residence time of 1 to 6 hours, that means the bone marrow constantly releases these stem cells. So when we discovered the effect of this blue-green algae in accelerating or enhancing the release of stem cells from the bone marrow, then I referred to this as endogenous stem cell mobilization, increasing the number of stem cells in circulation, not through an injection, but simply by boosting the release of your own stem cells. That's what.
What's the difference between having stem cells injected into you versus having your own endogenous stem cells?
I mean, the question can be vast here. It depends which stem cells are used, for an injection. But if we look at the whole question with some distance, you inject, let's say, 100 million stem cells in a normal injection. It can go up to, let's say, 200 million stem cells with a significant cost. There will be roughly, this is an estimation, but roughly about 15% survival. So you inject, let's say, 200 million stem cells, you will have about 30 million stem cells surviving in the body. When we take a product like the product that I developed, StemRegen, we can trigger, and this is all documented in the lab using flow cytometry. A normal individual will release on average about 10 million stem cells within 2-3 hours, their own stem cells. So if you do this twice a day, then you will send twice 2 waves of, let's say, 10 million stem cells. You do this for a month. This is 600 million stem cells that you have released during that month. That release is physiological, meaning it is not excessive, and these stem cells will find where to go and repair the natural way as stem cells are designed to go and repair. So the difference to me is that one increase in a sudden increase at one time with significant mortality, and what we do with the kind of herbal extract that I'm working with, or endogenous stem cell mobilization, is that you release a smaller number, but by doing this every day, cumulatively, you can get to a really significant impact. And we can get into that later, but as an example of that impact, we have an ongoing study right now, and we drafted like a preliminary report of that study that we submitted for publication. So it's an ongoing study, but on 10 patients so far with stable chronic congestive heart failure. So people who all had a ejection fraction less than 45%. The average was about 43. And 6 months later, every single patient have an ejection fraction above 50, simply by releasing their own stem cells every day.
Okay, before we go into that, because I know in the marrow, the red marrow turns into yellow marrow, which does not have stem cells. So by triggering endogenous stem cell mobilization, will we exhaust our own stem cells?
No, the phenomenon is the shrinking of your bone, of your red marrow into yellow marrow. So the amount of red marrow decreases over time, but the red marrow that you have continues to produce at the same rate. But because you have less of it, then you end up with fewer stem cells in circulation available to participate in the process of tissue repair. If you stimulate the release, your bone marrow is like a well. It will come back to its normal status almost immediately. And there are a few studies behind what I'm telling you. Let me mention a few. There's a study that was done. This was probably, I think, like 2003. And the question was, in a process of bone marrow transplant, normally we will do 200,000 stem cells per kilogram of body weight. That's the protocol. But in these 200,000 stem cells, the way that they are extracted, we don't really know how many of them are really stem cells. There's probably not a whole lot of them that are actually stem cells. So the question was, what if you have only one stem cells, but you are sure that it's a stem cells? What will be the impact of transplanting one stem cell? So they use a very ingenious protocol, because when you inject a blood sample into an animal that has been, where you have killed the bone marrow, only the stem cells will migrate back into the bone marrow. So what did it is that the irradiated female mice, they injected male stem cells, an extract of lymphocytes, and then within 24 hours, they went back and they did another bone marrow aspirate. The only cells that would be in the bone marrow then will be the stem cells. So they isolated them, and one at a time, they injected them into another irradiated female mouse. So one stem cell was injected into an irradiated female mouse, and within 6 weeks, the entire bone marrow was reconstituted, and the entire blood system was reconstituted from one stem cell. Just to understand here that we have hundreds of millions of stem cells in our bone marrow. When we release, let's say, 10 million, let's say you start with 150 million, you release 10 million, you're left with 140 million. If one stem cell can rebuild everything, 140 million won't have a problem. So it really does not affect the bone marrow. There's another way to look at it. Intense physical activity will trigger significant stem cell release. Have we ever observed that athletes that have been training for, let's say, a few decades, do they run out of stem cells? Is that a reality in athletes? No, it's not something that has ever been even reported. So releasing more stem cells does not have an impact on the bone marrow. And the last way to answer this question is to realize that the plants that we have identified having an effect on stem cell release, how did we identify them? We basically look into the historical use of plants worldwide, and we chose plants that historically had been used for many different kinds of health benefits, with the hypothesis that just like this blue-green algae, if it was reported historically to have a broad variety of health benefits, maybe the mechanism of action is releasing stem cells. So we have like this sea buckthorn berry from the Tibetan plateau, used for more than 2,000 years in Tibetan medicine, Mongolian medicine, Chinese medicine. And these plants have never been associated. They've always released stem cells. We're discovering a mechanism of action that has always been there. And never these plants have been associated with anything related to the bone marrow. So anyway, I'm answering this question from 3 different angles here, but there's no effect on the bone marrow other than giving back to your body a greater ability to repair on the day that we have released more stem cells.
What about age? Does aging reduces the amount of stem cells within the red marrow?
Yes. Well, the conversion of red marrow to yellow marrow will make you having fewer stem cells in circulation with aging. So there's a definite decline in the number of stem cells in circulation, not only definite, but very significant. So the estimation right now is by age 30, we have lost, or somewhere in our 30s, we have lost about 90% of our total bone marrow. And that is mirrored by a similar decline in the number of stem cells in circulation. Stem cells also age. So stem cells from, and this was mostly studied in animals, but you take, let's say, I don't know, a 10-month-old mouse, and you trigger an injury, and then you inject stem cells isolated from a day-old mouse or stem cells isolated from an 18-month-old mouse. And you will see that the younger stem cells are more effective. They will proliferate in the lab more effectively. They will differentiate more effectively. They will migrate more effectively. So we know that younger stem cells are better. And that is the advantage of umbilical cord stem cell transplant or treatment with umbilical cord stem cells. There are younger stem cells. But there are alternatives. Fat stem cells, for example, adipose stem cells, are relatively dormant. So they do not age because aging takes place through mitosis. So they do not really age like the stem cells from your bone marrow. So they are normally considered younger cells. You have V cells, you have a new type of cells called, I think it's multilineage, multilineage stress resistance, I think, stress enduring stem cells. And also they don't seem to age, and they seem to be able to become pretty much like close to totipotent stem cells, like egg and sperm. So extremely potent. These are all in the human body. I can add to this also one last little thing, which is that we can also, this is coming from 1 or 2 studies. So it's very preliminary. So it really needs to be confirmed and studied more. But it looks like fasting, which is known to be very rejuvenating, regenerative. Fasting seems to rejuvenate stem cells, meaning if you take stem cells from the bone marrow and you measure their ability to proliferate and to migrate in tissues, and then the person will go through a fast for 3 days, and then you take another sample from the bone marrow, you will see that the stem cells will have a greater ability to greater function. So it's almost like they are rejuvenated by a fast. So if we can find ways, fasting could be one, but if we can find ways to rejuvenate the bone marrow or even reconvert yellow marrow to red marrow or slow down the conversion of the red marrow, we probably would have found one of the greatest anti-aging regenerative strategy that we could find. So that's an area of research where I really would like to go.
Okay, I have an interesting question for that. Since you mentioned that stem cells, like fat stem cells, are somewhat very young and remains young, right? So does that mean that a really obese person would have more stem cell than a person with very low body fat percentage?
I do not know the extent of the difference between the number of stem cells in fat people and in people who are thinner. And I also do not know the impact of adiponectins and all kinds of compounds that are released by fat cells on stem cells. I did come across some literature just kind of pointing to the direction that, yes, you have more stem cells in people who have more fats, but the stem cells are oftentimes more subdued. they're not as potent or as effective as people who are thinner because of the impact of some of these adiponectins. But I would have to read more on it to be able to give you a better answer. Understand here, I'm not a clinician. So I don't practice these injections. I don't do that.
Okay. Yeah, it's a question I just thought of because I'm a fitness junkie, and though not me, but a lot of people in my community, they would like to get their body fat percentage really low. So whether having a really low body fat percentage is going to affect the stem cells that are going to be released into the body circulation, when they are working
No,
out and exercising.
no, it will not have an effect because those stem cells are not really known to mobilize. If they were mobilizing, then they would not remain young because then they will have you would either exhaust the tissue or they would have to multiply. So it is not a tissue that normally is known to mobilize stem cells. So even though you exercise a lot, when you release stem cells, it will be from the bone marrow. So it will not affect that aspect of fat tissue.
Okay, that's very interesting. So you're saying that right now, trying to maintain the pool of stem cell in the red marrow, that would be the holy grail of regenerative medicine, anti-aging, and living forever.
I mean, there are many things. There are, mitochondrial function. There's a lot of things that would help someone live longer. But at the end of the day, when we look at everything that is affecting aging in the process of disease formation, I believe that stem cells is the most fundamental. When we understand that not only stem cells is the repair system of the body, but it's also the renewal system. What I was referring to before, to this process of tissue turnover. If we have lost more than 90% of our stem cells at some point in our phase, then there's a point in our phase, early 40s, where we don't have enough stem cells to offset this ongoing process of tissue turnover. So that means there's a point where we start to accumulate deficits in various tissues. What is the loss of cells making insulin? It's diabetes. What is the loss of cardiomyocytes? It's heart disease. What is the loss of neurons making dopamine? It's Parkinson. Virtually every single age-related degenerative problem is the consequence or the outcome of the loss of a type of cells or a type of cellular function that stem cells can replace. So I published in 2013, I think it was in the Journal of Stem Cell Research and Therapy, that this decline, natural decline with age in the number of stem cells, is the fundamental cause of disease formation with age. And there's a way to test for this. Let's go and count the number of stem cells in the bloodstream of people who have developed various kinds of age-related diseases, and we should see fewer stem cells. And now there's probably 50 studies or so that have been published. And if you take people with heart disease, atherosclerosis, hypertension, any kind of arterial disease, erectile dysfunction, liver failure, diabetes, emphysema, COPD, Parkinson, Alzheimer's, lupus, arthritis, and the list keeps growing. All these people have 50% or less than the number of stem cells that you find in healthy people of the same age. So the main difference between a healthy 70-year-old and a 70-year-old who has a number of diseases, it's that the one that is healthy has naturally, by genetics, by whatever reason, has naturally more stem cells in circulation. So you add to this mitochondrial function, you can add to this a lot of different aspects to health, good flora, many aspects. But the bottom line is that they are the repair system and the health maintenance system of the body. So if you support that aspect, I am convinced that it's going to be tied to, I cannot say longevity, but I will say health span, meaning you may develop something just a few months before you passed. So people will live, let's say, the rest of their lives with a much greater level of health.
Okay, before we go into that, let's talk about chronic diseases and stem cell. You said something very interesting. There's a deficit between a repair and what is breaking down, and that's causing, say, diabetes, Parkinson, atherosclerosis. Can you elaborate more on that?
Okay, I want to be clear. I'm talking here very general. If you take diabetes, there's an autoimmune in some types of diabetes, there's an autoimmune process behind that is really sort of the disease process. But we have cases, we have documented them, and not just a few, many cases of people with let's say late onset type 1 diabetes. And when we use endogenous stem cell mobilization, by releasing their own stem cells, we can have a very, very significant impact on the diabetes. We will see the highs and lows disappear, insulin resistance disappear to a large extent, and oftentimes they can cut in half their amount of insulin. So just to show that the disease process is a battle between how fast the tissue is losing cells and how fast you can replenish those cells with new cells. Now, it depends if the process of tissue degeneration is caused by an injury, is caused by environmental toxins, is caused by diet, caused by stress, or it is caused by a genetic degenerative process or an autoimmune process. If it's autoimmune or if it is genetic, then you cannot really change the process. All you can do is try to repair on top of it. If it is simply an injury, like heart attack is a good example. We have good results with heart attack with endogenous stem cell mobilization because it's an injury one time, and after that, you're just left with an injury. If you can repair it, you can get good results. So we need to think of this balance between cellular loss and tissue renewal in terms of anything that could accelerate cellular loss, autoimmune problem, genetic problems, and how many stem cells are available to offset the simple process of tissue decline, if you want, tissue degeneration. Does that make sense?
Yeah, I guess as clinician, we never think about cellular replacement. Like we were just taught that the brain is the brain. It never regenerates. It is what it is. How many amount of cells that's there is fixed. Even the heart cells, maybe liver, yes, liver is regenerative, but the pancreas is fixed. Nothing, there's no such thing as regenerating of cells to recover from a disease.
Stem cell research is very clear. I can send you all the papers if you want. Let me describe one. Well, first, let me finish that statement. There's a lot of studies, very, very clear. Every single tissue of the body is constantly to a process of tissue turnover, giving you a new skin every month, a new liver 2-3 years, half of a new heart every 25 to 50 years. Even the brain, constantly in the process at a lower rate. Not all the areas of the brain have the same level of regeneration, but the brain does regenerate. Let me share with you one study, just for you and for your listeners to kind of see where this data is coming from. Because when I say the heart can regenerate and repair, what I'm saying here goes against everything that every single doctor has been told in med school. The heart is a post-mitotic organ after age 8 to 10. Then whatever you have is what you have. If you have a heart attack and you lose cells, too bad. You cannot make new ones. This is what has been taught in medicine, probably what is still taught today. And there's a group, this was published, I think, about 10 years ago. I think it was 2012. So the group used a reality of nature that is, I think the protocol is absolutely ingenious. They used the fact that before nuclear testing, there was virtually no radioactive carbon in the atmosphere. But after we started, of course, America, not alone, but America is the big culprit, when we started to do above ground nuclear bomb testing, the amount of radioactive carbon started to rise super sharply in the atmosphere. And until 1965, when there was an international ban of above ground nuclear testing, and now the radioactive carbon started to slowly dissipate through the stratosphere, being captured by photosynthesis. So there's an asymptotic decline in the concentration of radioactive carbon. Now, radioactive carbon is incorporated into our food chain through photosynthesis. And when I eat the plant or I eat the animal that has eaten the plant, I'm absorbing the amount of carbon, radioactive carbon, that was in the atmosphere. So on the day when one of my cells divides, and I need to make another filament of DNA, which is based off carbon, the carbon that is inserted into this new cell, the amount of radioactive carbon will reflect with, let's say, plus or minus 3-6 months, will reflect the time that reflect the amount of radioactive carbon at a specific time. So if you take someone born, let's say, after 1965, and a person who died in their 20s, 30s, whatever the age, and we take the heart and we measure the level of radioactive carbon in the filament of DNA in the heart, I can tell if the new filament were all clustered into the first 10 years of life, or if it's through the entire life of an individual. And the answer is that the process continues during the entire life of an individual at a rate of roughly about 1% a year in the first 25 to 50 years of an individual. So that means at age 50, roughly, and it depends how you look at it. If you look at cardiomyocytes, then it will take about 50 years to replace the heart. If you look at all the heart cells, you will replace about half of your heart in 25 years.
Well, so that means every 25 years I get a new heart.
Every 50, well, we need to make the difference between cardiomyocytes and heart cells in general. So roughly in your lifetime, you will have roughly renewed your heart, let's say 75 to 80% of your heart in your lifetime. If your cardiomyocytes, if you look at your heart, it's your entire heart, you will have changed your heart in your lifetime.
Well, so this is, like what you said, this is really going against everything that we've been taught, everything against a lot of our medical training. So like for us, during my medical school, my medical training, even my entire medical career, like I've been told that diseases like all these chronic, non-communicable chronic diseases like diabetes, heart failure, atherosclerosis, hypertension, all this cannot be cured. It can only be managed symptomatically, or actually it is symptomatic because you never really get to the root cause and really curing it. You only manage the disease with drugs, with medication. In your opinion, like why is it that we are still stuck in this concept?
I mean, it's a hard question, but my best answer to that question, it's just because until we discovered this role of stem cells in the body, their role was invisible. So we had no understanding that the body is a repair system. If you get a cold, you will take things that stimulate your immune system. If you don't produce enough insulin, you will take something that will stimulate your endocrine system to produce more insulin. Well, if you discover that you have a repair system, wouldn't it be wise to stimulate your repair system if something is broken in your body? So the moment we discover that the body is a repair system, literally a repair, just like you have an immune system. This is not an analogy. This is not like some form of a comparison. It's not an image. It is not a metaphor. The human body has a repair system just like it has an immune system. And I can go into all the detail, and when we go to all the detail of how it works, I will have described something that looks very well, very much like the immune system, how an immune cell will go to a site of an infection and deal with bacteria compared to a stem cells going to a site of an injury and repair that tissue. It is the same thing. They work very much the same. So once we understand the human body as a repair system, it kind of changes everything. If we put more stem cells if we boost that repair system, we can help the body repair a lot of things. But my answer to your question is that until we knew what I'm sharing right now, what I'm talking about, it was happening in the body, but it was invisible. So we did not know that those tissues were always going through a process of tissue turnover because it's invisible until you tag these stem cells. And this has been seen in animals. It has been seen in humans. I talked about the sex mismatch kind of experimentation or observation that were made. We did it. When we did our study on the muscle injury, when we look at mice months later, we saw green everywhere in the mouse, not just in the muscle, everywhere in the mouse, meaning the stem cells, when not only went where they were when there was the injury, this is where they went acutely, but chronically over time, they went everywhere in the body as part of this just normal process of tissue turnover. We just need to start to wrap our mind around it.
Okay, so let's talk about, let's pick a disease so that my listeners can also grasp, let's say diabetes. So type 1 is an autoimmune condition where the immune system destroys pancreatic cells. But in type 2, it's insulin resistance. So how would stem cell play out for these two types of diabetes?
Okay, we say that the cause is autoimmune. I'm not a clinician here. I'm talking really about a scientist in the lab, okay? So I have never really worked with patients. It is an autoimmune problem, suspected to be an autoimmune problem, not always an autoimmune problem in some people. Sometimes there's injuries that can be created by different environmental toxins. So my point is that we need to make sure what case it is. If it is an autoimmune, let's start with the first one. If it is more of an injury, like a one-time thing, you start to put stem cells in circulation, you start to repair the pancreas, you can get rid of it. We have a case like this. We published a case a number of years ago. A year later, the person was completely normal, no longer needed insulin. So we have seen it. In a case that are truly autoimmune, all you have is that you have a balance. I'm going to make an analogy that is like too simplistic for doctors, but I think it's important just to keep the whole image in mind. Your health and your stem cells, it's like a bank account. What you have in your bloodstream is your bank account. So is your health capital. When you're young, you have a huge income in stem cells, and you're growing, and you're in expansion. As you age, your income goes down. You have fewer and fewer stem cells, but your expenditure in stem cells starts to grow bigger and bigger. There's a point where you don't have enough income to offset your cellular loss. Now you start to have a decline in your overall health. And there's a point when you run out of stem cells or run out of health capital, now you develop a disease. That's like the bankruptcy. So my point here is that it's all the balance between your income and your expenses. So take diabetes. You lose more cells in the pancreas because of an autoimmune process. You need to have more stem cells to offset that process and repair faster than normal. If you can repair fast enough, you can have a significant impact on the quality of life of the diabetic patient. You have not changed anything to the disease process. We still need to find a way to get rid of the autoimmune problem, but we have seen in many diabetic patients very, very significant improvements. Let me share with you one case. It's not diabetes, but it's the case that led me to think of this whole concept of health being a balance between cellular loss and tissue renewal. It was the case of a 4-year-old girl. She had spinal myopathy, genetic disease. She had 2 hands completely paralyzed in a wheelchair. So the doctor told the mother at 4 years old, she would never get better. It's only going to go down. She had never stood up. She had never walked. She was able to crawl some on the ground. So the mother asked me if she gave the daughter the blue-green algae extract that we had, which was the first ingredient that we had documented, could that help her? And I told her, you're going to release stem cells that have the same genetic problem. So it's not going to help. So she said, can I try it anyway? I mean, it was in France. It's a free country. So sure, give it to your daughter. She called me 3 weeks. She sent me an email 3 weeks later. For the first time, her daughter stood up. Another 3 weeks, for the first time, her daughter made 5 steps. And within about a month later, her daughter was walking. So I'm looking at this, and the only way that I can explain it, I haven't changed anything to the disease process. Nothing was changed. That genetic problem is still there. But if I can feed enough stem cells to repair the tissue faster than the tissue degenerate, I can maintain some level of functionality. I'm not telling you that that's what happened in that young girl. What I'm telling you is that seeing a lot of those cases, it's those cases that have inspired. I can explain all those cases with this concept of seeing that everything is a balance between how you lose cells and how much you can replace those cells. And that is true for something like diabetes, that is autoimmune. But for our disease, like congestive heart failure, this is, if you remove out of this high blood pressure that is not treated, it is an injury. You don't have an autoimmune problem with the heart. So if you can release stem cells that will go and repair the heart, we can repair, and after that, the case is closed. And we have many of these cases, and all these cases have culminated into a study that we're doing right now with people with stable chronic congestive heart failure. And we trigger endogenous stem cell mobilization 3 times a day for 6 months. And so far in that study, all patients have normal heart function after 6 months.
Wow. So they went from having a congestive heart failure to now being normal like anybody else. Because from, again, what we've been taught, the old way of medicine, right? If you have congestive heart failure, it hits a certain level, you go for a heart transplant. So
Correct.
Now you're seeing that that is not the only way to regain your normal life.
We have one participant in these studies that was with 13% ejection fraction. So he was on a heart transplant list, and they really did not believe that he would survive the time that it took to find a heart. In the meantime, he started to take some of these plant extract that act as stem cell mobilizers. They finally called him 3 months later. They had a heart. He drove himself to the hospital, climbed the stairs, walked in front of them, and they saw how he was. They canceled the surgery. They did tons of tests on him. And at the end of all these tests, the outcome was he was not like he was not an athlete ready to run a marathon, but he was like any other 65-year-old. I believe, if I remember well, his ejection fraction was 48%. All he had done was release his own stem cells. And I want to make one more statement to what I was talking about with that balance. The one thing that has led to the understanding that you're sharing right now in medicine, tissue don't regenerate. In medicine, when you have a problem, there's nothing that you can do. It's because most of these problems, if not all of them, they all happen at a stage in a person's life when the number of stem cells have declined substantially. Before that, the problem was not there. So I can surmise the problem was not there because the person had more stem cells in order to repair. So the problem would not show up. The problem was there, meaning there was probably a loss of cells, but it was compensated by repair, so it did not manifest itself in symptoms. When the stem cells kept declining, the problem started to grow. So to me, it's all a matter of the balance between stem cells, the number of stem cells available, and how many of them are there to repair the tissues, maintain, compensate for the process of tissue turnover, which leads then to endogenous stem cell mobilization. If there's a mean of putting more stem cells, if there's a mean of taking you in your fees, and today, through releasing your own stem cells, I give you back your ability to repair that you had, let's say, when you were 30. On that day, you've achieved something great for your body. And I do this every day. Cumulatively, it brings you back to a much greater level of health. That's what we're doing with these heart patients. We have started a study on Parkinson as well, because we have had a number of Parkinson patients in the past with good results. And then in that study so far, it's preliminary. So I'm analyzing this right now because I may present this at a conference at the end of this week. But the last time that I analyzed the preliminary data that we had, which was over 4 months, so with 4 patients, we had at that time 50% reduction in motor symptoms, 36% reduction in depression using the Beck scale of depression, and about 56% improvement in quality of life using SF36. And that is representative of what we have seen over the years. And I would not have chosen Parkinson or heart disease 20 some years ago when I started that. I believe that nothing can cure Parkinson. Nothing can cure heart disease. I was very surprised. When I saw it, I did not believe it. But when we started to look at the medical records for this gentleman that was on a heart transplant list, then we could not deny that releasing our own stem cells really had an effect on health. So now we're documenting this in clinical trials.
Well, this really requires a lot of mindset shift and a paradigm shift, especially among the medical fraternity, because what we've been taught has been so rooted, but being open that science is continuously evolving, we're always going to keep finding something new. So, Christian, I want to, stem cells, like I mentioned, only in the knowledge I had before this conversation was so limited, only in the marrow producing blood cells. But then there's a story I came across, Dolly, the sheep, using stem cells to clone the sheep. It felt so freaky because it's like something out of the movies. And then, but I worked in a medical research facility for a short period, and I met a professor. She managed to create a cornea from stem cell. And this cornea was successfully transplanted into a patient. So that's when I started seeing, like, obviously it's many years after I've read about Dolly the sheep. So it started to make me see that, hey, there is so much potential in this, but yet we're still very, we're still very conservative. We're still very afraid of the potential of stem cells in the medical fraternity. And there's all this issue about ethics, taking stem cells from the umbilical cord or fetuses and all. So why do you think there's still so much misconception about stem cells?
Okay, first let's start by really differentiating some of the examples that you talked about. Dolly the sheep was embryonic stem cells. There's nothing today in the treatment world that uses embryonic stem cells. And for one main reason is that there's a risk that is too high for tumor formation. So that is why they're not used. So every single treatment that we're talking about, they're always adult stem cells. Umbilical cord stem cells or adult stem cells. So if we talk about stem cells, so the reason why I think it's so hard to wrap our minds about this, and what I'm going to see is humanness. So I'm not going to have like a big technical information. If you're taught something in med school by academia, by professors, you live with this for the rest of your life until you really find something that is going to be significant enough to change your mind. Otherwise, if it was true, they will teach it in college. My professor would have told me. And I think that there lies probably the biggest obstacle for this information to become widely known. To realize that there's something that is extremely, fundamentally, it revolutionized medicine. And it did not come from academia. It came from practice. It's hard to swallow, but it is just a reality. It is something that will completely change the way that we practice medicine. There's a lot of fear because there's a lot of stories that were made about Dolly the sheep, like what you're talking about. There's a lot of stories that were made about these. There are some clinics that are not necessarily ethical, that are using stem cells, harvesting them in a way that opens the door for contamination with some serious case of sepsis and side effects. But when it is well done, honestly, there are way fewer side effects than with traditional drugs. Way fewer side effects. You understand that taking drugs as prescribed, at least in America, it's right now the fourth leading cause of death. Consequence of taking medications. You don't have that with stem cell injection, with stem cell treatment.
Yeah. Before we dive back into this incredible conversation, there are a couple of exciting opportunities with disruptive doctors that I want to share with you guys. First, if you're a doctor who's thinking about moving into a non-clinical career but don't know where to start, or even if you're a doctor who's on the fence thinking if you should leave medicine or stay, the non-clinical career pathfinder by Disruptive Doctors is designed specifically for you. The problem why we doctors think that there's no opportunities for us out there is because we've been trained in sick care all our lives, but that's not true. Healthcare is a huge ocean. What you learn in this workshop is discovering yourself, where to find all the opportunities within healthcare, your game plan, and insights from me and Vivek on how to do it. And the best part is it comes with a 14-day guarantee. By the end of this workshop, you gain so much clarity on what you need to do, or if staying in medicine or leaving for non-clinical practice is for you. Our proven framework has helped more than 1,000 doctors on finding a fulfilling career. So stop wasting your time trying to figure it out all on your own in the dark. So sign up for our next workshop on our website. Next, mark your calendar for Disruptive Doctors Annual Conference and Exhibition. It's happening the 20th and 21st of September. This conference isn't about fitting into label. It's about expanding what is possible in healthcare and reimagining the doctor's role in it. This is where forward-thinking doctors come together to drive real change in healthcare. For those who refuse to settle, this flagship event brings together doctors from diverse backgrounds to explore fresh approaches, share ideas, and connect with a community of doctors to impact healthcare differently. Remember to get your tickets on our website at disruptive-doctors.com/conference 2025. And finally, if you haven't already, please download the Disruptive Doctors app. It is a global hub where you can connect, collaborate, share experiences with doctors across the globe, and you don't have to be limited by geography. This is more than an app, it's a movement. So be part of the community of doctors who are impacting healthcare differently. And also, can you do me a huge favor? If you have not subscribed to the channel yet, please be sure to subscribe, because it's subscribers like you that help us bring better guests for you. So whether it's the workshop, the conference, the app, or just subscribing to the channel, be sure to do it now. Now, let's get back to the conversation. I do have one question. I mean, it may be related or not related. So, during COVID, everyone had to get a vaccine. But what if we got stem cells instead of the vaccine? Would it have changed anything?
It's a very interesting point that you're bringing because stem cells, mesenchymal stem cells, are extremely anti-inflammatory. You know, if you go back to any injury that you've had, let's say you have a cut. That cut, you will have inflammation, but when it starts to repair, the inflammation goes away and oftentimes the pain goes away when it starts to heal. And that's the role of mesenchymal stem cells. They're attracted to an injury. When they get into an injury, the first thing that they will do, they will suppress the inflammation, suppress the nociceptive signal, the pain, and then will start to repair. So, but they're anti-inflammatory very, very locally at the site, the very site of the injury. So when you start to have a cytokine storm with COVID or with the vaccine, and you're starting to damage the lung by an excessive immune response, mesenchymal stem cells will migrate in the area and will shut down this inflammation and will repair. So they did that study. It was done by a group that was in China, but also in collaboration in Dallas, in America. And what they saw, I think it was 9 patients that were in ICU. And then they injected not umbilical cord. They injected mesenchymal stem cells, and every single patient that received mesenchymal stem cells within about 2 days left the ICU, were returned home, and they were fine. So I won't say I have no doubt. I think that if that was utilized as a way to treat people with COVID, I think that we would have seen a much different picture.
I mean, just thinking about it, because obviously I was there when all this happened, and there were a lot of lives lost in the ICU, and, knowing that this could have changed a lot, right? Like this could have, it's not only beneficial for the patients, but for the doctors, because we were all overworked. We were all working round the clock, and it was a really, really tough period. But just thinking about how this could have changed the narrative back then.
I mean, it was a study in 9 people. It would have to be done in more individuals. It would have, until it's really studied, we cannot make, a strong affirmation. But let me just say that the data that we had was really indicative that it could have made a difference. I mean, we had a doctor in Turkey that he was a pulmonologist. So he was in the hospital right in the thick of it, and he caught COVID. And he was himself in ICU for 12 days. And at some point when I had a chance to speak with him, I said, but you know about this product that can release your own stem cells. And we talked about the effect of stem cells. But just like you shared before, he's a doctor really into the path of everything that he knows about medicine. And what I shared with him about stem cells and releasing his own was just an interesting entertainment. It was not really medically valid. So he started to use these plants that do endogenous stem cell mobilization. Within 2-3 days, he was out of ICU. So we've had those cases as well.
Is there a limit as to how much or what stem cells can really do? Because I had a patient who had a gangrenous foot. Obviously, while he was admitted, no doctors wanted to administer any stem cells for him. So he discharged himself and started taking stem cells. But I don't know what happened after that. So is there a limit as to what stem cells can actually do and what it cannot?
The answer is not so much into what stem cells cannot do. The answer is more into how capable is the terrain to fully take advantage of those stem cells. I can show you a video, if you want, by the group of Doris Taylor. They took the heart of a mouse. In that heart, so they isolated the heart and circulated on the cardiac muscle proteolytic enzymes to digest all the cardiac muscle. And at the end, they're left with the connective tissue of the heart, the collagen of the heart that still retains the trace that it was a heart. And on that collagen, they laid out stem cells taken from the animal. And within a week, they have a beating heart in the test tube. Impressive. These stem cells were not tweaked in the lab. Nothing was done. We just took stem cells from the animal's bone marrow, laid that out on this cartilage tissue, this collagen tissue, and then it became a full beating heart in the test tube. So that's what our stem cells can do in our bone marrow. The question is, why is it not happening in everybody? And why is it that when we inject stem cells, we don't get this phenomenal results in everybody? And I think the answer is more, what is the access of these stem cells to that tissue? Systemic inflammation will suppress the ability of stem cells to find what is the one area that needs repair. Oftentimes gangrene, or because if you talk about gangrene, oftentimes it's associated with diabetes, or it's associated with poor vascularization, poor blood circulation. Well, poor blood circulation means poor delivery of stem cells. So you can put stem cells in the body. It doesn't mean that it will reach the area. But I can send you pictures if you want. We have had historically people who were scheduled for amputation, toes amputation, for example. And the moment they start to take these plants that trigger the release of their own stem cells, you saw that the gangrene go away and they were able to keep their toes. The only answer that I don't have until we do a clinical trials is how many people tried it with gangrene. And I just heard about maybe the one good story. Is it 1 out of 10? Is it 1 out of 100? I don't know. But I can tell you that yes, stem cells can, in some cases, reverse gangrene and allow somebody to avoid amputation. We have seen it, definitely.
There's a lot of potential here. So, okay, let's talk about longevity and stem cell. Earlier, you did mention the word longevity. So it gets thrown about a lot these days. Is it a trendy buzzword and tied with everything from supplement to skincare? Or is longevity something real, a real concept that's backed by science? Or is it just a marketing gimmick?
No, it's not a marketing gimmick, but we need to understand that it's a very complex term. What I mean by this is that longevity is something that we will all experience in 50 years from now. So if I were to ask you, who will you be in 5 years from now? You probably could not answer. You don't know what will be your life in 5 years from now. So to talk about what we will be in 50 years from now is so elusive. It doesn't mean a whole lot. And if you try to do something to help your longevity, but you reach 80 years old and you have a disease and it did not work, you cannot go back and change it. So you need then to refer to markers of longevity. So you see, we're almost like we're working through layers of proxies to try to understand a phenomenon that will happen, down the road. So right now there are markers that have been identified that in animals can have an impact on longevity. But even that is kind of a little bit problematic when we extend it to human. Example, we know that if we fasting, for example, fasting in worms, in yeast, in mice, in fish, in fruit fly can increase lifetime by up to like 50%. But the moment you do that in dog, it's 15%. In monkeys, no real improvement, because we're affected by gravity in a different way than a fruit fly is. Muscle mass is very important for a human or for a bigger animal to be able to have health. So I'm saying this because there's a lot of studies studying markers of that are associated with longevity, but these markers don't always pan out for humans. But they do point to physiological processes, cellular processes that have been identified and associated with longevity. Autophagy, for example. If you activate autophagy in cells, it will help and improve health. So in all of this, I think the message to keep in mind in the science of longevity is that there is one thing that all centenarians and super centenarians share as a common trait. It's not genetic, it's not like specific genes, it's not epigenetics, it's not genetic expression. They do share some characteristics, but the one thing that they all share is that they did not develop a disease until a few months before they passed. They lived for a long time without any disease. So, and we have seen earlier, we develop disease as a consequence of a decline in number of stem cells in circulation. So that is why I do believe that stem cells, endogenous stem cell mobilization, putting more stem cells in circulation to allow the body to delay the onset of the development of age-related disease is probably going to be one of the most important strategy if we really want to have longevity, or put aside longevity, making sure that, let's say you don't live longer, but all that time between now and the time that you pass, you can experience good quality of life.
Okay, what's the difference between aging and longevity?
Well, aging is just aging, meaning like how could I say? You go through the decline that is associated with age. Longevity normally is, and we can there are a few cases that have been documented. They're debated because the belief is that people cannot live that long. So because they cannot live that long, then the story cannot be true, which is kind of I find it a faulty scientific process here when you refuse to observe something because you don't believe that it can be true. But there are humans that have been there's a case in China of a man who lived 250 years. There's in Kazakhstan, I believe, 168. There are a number of these individuals that have been documented for living extended periods of times. That is longevity. How can we make the human body live longer? Because if we look at various animals, you look, for example, in dog, horses, and in elephants, and in all kinds of animals, and you make the ratio of their life expectancy divided by the age of puberty, and you will get a ratio. You go into lower animal like a mouse, and it can be 15 to 1. So they have that's the number. If you go into elephant, I believe it's 4 or 5 to 1. If you go in human, you're about 6 or 7 to 6 to 5.6 to 6 to 1. But we live with stress. We live with environmental toxins. We live we cannot say that we live in an environment that can fully express our longevity. The closest to us would be the chimpanzee. The chimpanzee is about 7, if I remember well. So if you take 7 and then you multiply that by the time of puberty for human, that is 15 years, that means we should live up to, let's say, 115, 105, something like this. It should be our normal life expectancy. That is longevity, is to look at the comparison between men and other animals in the animal kingdom, and to basically evaluate if we align everything. We align proper diet. We align exercise. We align stem cells. We align good flora. We align all the things that we know are good for health. If we align all of this, can we reach a longevity that is predicted by these calculations, which would be around, let's say, normally it's estimated to be anywhere between, let's say, 110, 120 years. We will see.
Well, so has this got to do with your chronological age and your biological age?
Chronological age and biological age are different concepts. So, for example, one of the signs, one of the markers of longevity is DNA methylation. As you age, you have more and more DNA methylation. If you can reduce the DNA methylation by fasting, by different approach, you increase longevity in animals. So we assume it's going to be the same thing in humans. So we go and we measure DNA methylation. And if you have, at 50 years old, the DNA methylation of somebody who would be normally 40 years old, then we say your biological age is 40 years old. I think it is clear, and we need to kind of agree with one thing. Biological age is a true phenomenon. What I mean by this is that go back now in your 50s to a high school reunion with all the friends that you had when you were 12 years old. Some of them you recognize right away. Others, you actually do not recognize them. We do not all age apparently at the same pace, but we're used to see age as a chronological thing. Like in a week from now, you'll be 1 week older than you are today. Like it's linear. You cannot change anything. Our biology doesn't work really that way. So that's the concept of biological aging. My reluctance to really put a lot of emphasis or a lot of, I wouldn't say belief, I don't really function a lot with biological age for one reason. Take DNA methylation. Studies have shown that if you take somebody who goes into surgery and you take a blood sample the day before surgery, you measure DNA methylation, and you measure DNA methylation the day after the surgery, significant surgery, like knee replacement surgery. The person has aged 10 years. Of course, the person has not aged 10 years. There are parameters in the body that has reacted to the injury and now have shown a biological aging of 10 years, but the person has not aged 10 years. So if something like DNA methylation can fluctuate that quickly overnight, I think it is a little bit, I'm not sure if it's valid to assume that by shaving 10 years of my biological age today means that in 50 years from now, I'm going to have an extra 10 years to my life. if it can change overnight, there's a good chance that it will change in the next 50 years. So I think that there are good indications telling us that if we do things in our lives, dietary, supplements, lifestyle, that are going to positively affect those markers of biological age, then these are things probably that we should continue to do, that we would take the habit of continue to do for long periods of time. They are likely to really help us age with better health. I think that this is where these markers of biological age are really interesting.
So what's the markers for longevity right now?
DNA methylation is probably the most relevant. Another one would be also to measure glycation. Glycation in the body is also another markers of biological age. I mean, all the consequence of diabetes is glycation taking place in the body.
So are these blood tests that could be done in a regular lab, or is it more complex?
I mean, I don't know the method that is used to do them, but right now there are companies that are doing this. It's very simple. There's Glycage. There's a number of them. Their name is not coming to mind right now, but that's what they do. They measure telomere, they measure DNA methylation, they measure glycation, they measure different markers. I mean, honestly, let's look at this from a distance. You can use blood pressure. The blood pressure of a 30-year-old is about 120. The blood pressure of a 60-year-old on average will be 130, 135. Blood pressure normally increases linearly with age. So if you're 50 or 60, but you have a blood pressure of 120, that means, according to your blood pressure, your biological age is 30. So we have had those markers all in our lives. It's just that it has become a concept recently that is used to identify things that we can do to hopefully live longer. So fasting helps you reduce your biological age. So probably fasting will play a role in longevity. So I think that that's why these markers are useful.
How does fasting play a role? Is it your autophagy, or is there more?
The assumption right now with all the information available is that it is autophagy. What is interesting, though, is that it is autophagy through the presence of ketones. Because at least in mice, if you feed mice a diet, directly ketones, or a diet that is going to generate ketones, you can mimic all the benefits of autophagy that you get in a mouse that is fasting. So it's tied to the ketones, but from a cellular standpoint, I think that the process is autophagy, which is easy to understand. We oftentimes don't realize the degree of garbage that is in a cell with so many misfolded proteins, organelles that have been damaged that the cell basically just stopped utilizing, and they stay there until the process of autophagy, because the cell needs energy, so it will turn on itself and will release enzymes to basically start to digest all these debris that are garbage in a cell. And then your cell becomes more effective because it has cleaned up itself. So it's very easy to understand how activating the process of autophagy can really help, healthy aging. And that is why that has led to the concept of what is now called, in science, they call it a time-restricted feeding, but in popular language, they mention it as intermittent fasting, which is be at least 16 hours in the day without food in your stomach, because at that point, the body will start to enter into a process where your cells start to activate autophagy. So if you do this every day, this process of autophagy, little by little, will clean up your body, over time. There are supplements that can stimulate autophagy as well in the body, like spermidine.
Okay, so how do we combine like stem cells, fasting into improving longevity, or improving longevity and your quality of life?
It's a big question, because I think if somebody starts to look at all of this and say, let's do all of it, it gets like overwhelming. So I think we kind of get into it one little thing at a time. Fasting, you pick up fasting, it's not the simplest. For many people, it is difficult to fast. You need to almost train the body to fast, because if people are used, as soon as they need energy or they feel weak and they reach out for something that is sweet, then that means the body has been completely trained to take the energy strictly from sugar. You need to be able to train the body to take it from fat. And when you do that, that's when the body starts to produce ketones, and you will realize that the energy that you get is much, much milder but you can concentrate so much better. So you need to train the body to fast. I think ultimately, if somebody does, let's say, 3 days fast, not more than once a month, ideally maybe at the change of season. At the change of season, you take 3 days. When you don't have food, you only drink water. If somebody can do this, it's a really good approach. You can use spermidine to activate autophagy as well. So it's extracted from wheat germ. It's available in the marketplace. Releasing stem cells every day will boost the ability of the body to repair. There is one thing that is probably the most universal thing to do for longevity. It activates autophagy. It reduces DNA methylation. It improves blood circulation. It improves also cognitive function. It is physical activity. Do at least 3 hours, 2.5 to 3 hours a week of physical activity that is enough to really break a sweat and bring up your heartbeats. Do this for at least 3 hours a week, and it's enough to activate pretty much all the processes, sirtuin genes, everything that has been associated. One of the most important things, it really helps so many different things in the body. Another one, mindset. To me, that's the one that I think is the least talked about in the whole field of longevity. But to me, it's probably one of the most important one. We mentioned earlier this man. There's a whole book about him. This man who lived apparently up to 256 years. The numbers may not be all okay, so it's either 256 or 197. Either way, it's a long time. And when he was asked what was his secret to longevity, his answer was, I keep a light heart. So we need to kind of sit back with this. We need to sit down with this. That means if you meditate, and if you realize that, like Mark Twain said, Mark Twain, an American writer, said, I spent all my life resolving problems that fortunately never happened. All the time, we're constantly thinking about things. The mind never stops thinking, and most of what we think about actually never happens. And we're caught into this thinking process. And my point here is that if we can calm the mind and realize that we are making things into problems when oftentimes they're not problematic, the stress associated with this has a high cost on our health through various aspects. And we can look at many verticals of the impact of stress on life. Stress will increase high blood pressure. Untreated, it's heart disease. It will shorten your life. Stress also will reduce stem cell function. Stress, cortisol, more specifically, adrenal hormones have been documented to suppress the ability of stem cells to migrate into tissues and proliferate into tissues. So you look in modern life, even a child at school start to be exposed to significant amount of stress. And for decades, we lived exposed to a significant amount of stress. During all those years, our ability to repair and maintain our health is decreased just by stress. So controlling stress and really having peace of mind can have a huge impact also on longevity. It is another of the factors that we find in all centenarians. Most centenarians have peace of mind. They live with the joy. So these would be like, and then you can start to add different other things that are more like technical, like red lights. Red lights have been well documented to increase mitochondrial function. And it's not just the area that you expose. You expose your face to red light, and the benefit will be for the whole body. Pulse electromagnetic frequency is also, I don't know if you've used this in the clinic, but it's also fascinating what it does for joints mostly, for many things in the body. And it was well documented that one of the main mechanisms of action of pulse electromagnetic frequencies, PMF, is that it supports the migration of stem cells out of the blood into the tissue, their proliferation, and their differentiation specifically into tendon, muscle, ligaments, and bones. This is where most of the studies have been done. We don't know. It can also help maybe the heart, the liver, and the lung. Right now, most of the studies have been done on joints. But pulse electromagnetic frequencies is really good for health. What else can we add to this whole arsenal for health? Cold plunge, it is becoming very popular. Cold plunge it is probably the cheapest thing to do that has been associated with longevity. It triggers all the processes, the cellular processes, the physiological processes that have been associated with longevity are triggered by a cold plunge. So you take a water bath that is at roughly, let's say, 37 to 40 degrees Celsius, and then you get into the water for about 3 minutes, and do this every day. It triggers cold shock protein and then when you're in Malaysia in the hot season, you will feel fresh for the whole day. Literally, I've done it many times. So really, really good for longevity. To the flip side of this, sauna. One of the main benefits of sauna is that and to my knowledge, it's one of the few things, if not only things, known to reduce glycation. Glycation, in a diabetic, we see the extent of what it does. But in a non-diabetic, if we use a lot of sugar and we have a lot of these spikes of glycemia in our blood, we also have glycation. We just don't have glycation to the point where it develops an actual disease like neuropathy, poor circulation. But you take somebody who is not diabetic, who has lost their balance. Like they walk, they're fine, but they don't have the same balance that they used to have. Well, quite likely, it's just a subclinical level of neuropathy that is just a consequence of glycation. Sauna can help reverse that glycation. So when we look at longevity, trying to align all the little things that will be beneficial for a longer life and healthier life, and when we start to accumulate all of them, then we can think of living longer, or at the very least, living better. So these are all little things that we can add one at a time. Sleep is another one. It's unbelievable the number of people who do not have enough sleep. And what is interesting with sleep is that there's a nice window. It's 7 to 9 hours. More than 9 hours is associated with the same kind of morbidity as less than 7 hours. So 7 to 8 hours is the ideal amount of time to sleep, with at least, you would like to have at least, let's say, an hour and a half of deep sleep. And if you don't have that, we know that with all the phenomenon of the lymphatic system in the brain cannot eliminate its toxins. So, and we have we have an increase in the incidence of neurodegenerative diseases, and we also have an increase in the incidence of insomnia, poor sleep. I'm not saying it's all related to this, but it's all part of the development of these neurodegenerative problems. The brain cannot basically cleanse itself.
So I guess if you're going to do all this, because I've experimented with almost half of the things that you've mentioned, but there's no real tracking system that has been in place. So you don't know if all these things you're doing is really giving you any impact at all. So would you say you need to track? Is there a way to track, like, okay, all these things that I'm doing is effective?
There is. There are clinics. It's very popular here in America. There are clinics, and they specialized in that. So you go there, and oftentimes you go there like as a healthy person. This is something that is developing right now in America very, very strongly. I don't think it has developed in Malaysia in the same way. So people will go to see these clinics, and they're healthy. I don't have any health problems, but I go in this clinic because I want to optimize my health. I understand that my health in 50 years from now depends on how I optimize my health today. So people go and then they do a whole battery of tests that will measure DNA methylation, epigenetics, gene expressions, the health of the cardiovascular system, glycation. I mean, they have a whole series of tests. One of clinic that I know that I'm working with, when you go there, you spend 2-3 full days of testing, just like quantifying all kinds of measures associated with your physiology and your body performance, if you want. And then given the set of data, then they put you on exercise, sauna, red light, cold plunges, pulse electromagnetic frequencies, like all kinds of modalities like this, all aimed at improving your overall health. And that is monitored by seeing all these measures change over time. So it's very, very clinical.
Okay, so, as doctors, we often hear about all these exciting advancements, but we always face barriers when it comes to actually applying it in our practices. Some of it could be regulatory. But what do you think as doctors we can start implementing, especially stem cell-based approaches in the clinic itself?
I mean, first, I would say nothing will be successful in a clinic if belief is not there. So I think it starts by really honestly realizing that science evolved, and if we were not told at school, in college, during your medical training, everything that we know today about stem cells, it doesn't mean that it's not true. So I would say start reading about it. That's why I wrote the book, Cracking the Stem Cell Code. It's to explain what is the natural role of stem cells in the body and what is the impact of stimulating stem cell release. These are studies that are done with GCSF, granulocyte colony stimulating factor. This is what your body will release when you have an injury to trigger the release of your own stem cells. It's your normal repair injury signal. And so it has been used in many kinds of injury models. Parkinson, Alzheimer's, heart attack, bone fracture, atherosclerosis, arterial disease. Emphysema, liver failure, kidney failure. Every single disease has pretty much been studied with that protocol and shown to bring benefits. I can show you all these studies. A number of them are in that book to just show that when we increase the number of stem cells in circulation by releasing our own stem cells, the impact on health can be very, very significant. So I would say read on it and realize that it is a real thing. And from that point on, I would say it is not something to do only when there's a disease. It's part of our normal aging. So start, even for a doctor, start using it. Start to see what it does in your life. If you want to see what it does, it's very simple. If you have an old injury, you have a good chance that it might repair. It has not repaired because there was not enough stem cells to operate the repair. If you don't have anything, go do a very good workout. Go on a hike that you know the day after you will be very sore. And then take 2 capsules of Stem Regen, the product that I developed, and then you will release stem cells in 2 capsules before you go to bed. And you'll see the day after you're not sore. It will show you in your own body what stem cells can do. Then start to use it with patients and see what it does for the patients. It becomes an experience to have in the clinic because academia is not there to give that knowledge. So now everyone have to decide to see what it does for themselves in their clinic. I can tell you, if a doctor starts to use the product, they normally continue. They don't stop. I've been doing this for 20 years. We cannot reach easily mainstream medicine. We reach regenerative doctors. We reach the doctors who, and I'm going to use the work that they're telling me, because I ask them sometimes, what is your interest into stem cells? And the answer that they give me, which is probably the same reason why you're no longer in the clinic like you used to be. They're saying, I've been practicing medicine for 15, 20, 25, 30 years, and I have to reach the conclusion that there are many patients that I cannot help. And these patients that I cannot help, why can I not help them? And now I hear all this information about stem cells, and it just makes a whole lot of sense. So I want to see if I can help my patient with it. And when they start to use it, endogenous stem cell mobilization with their patients, and they see the results with their patients, they continue to use it because they see that it really helps their patients. I think that that's really how to do it.
Okay, Christian, this has been really an eye-opening and inspiring conversation, and you've challenged a lot of my long-held beliefs of, what I was trained for in the past decade and a half. It really gives us the hope that medicine, like the future of medicine, because like what you were mentioning about this doctor, I did feel at one point I wasn't doing anything for my patient. There was nothing I was really changing. I was just fixing the symptoms. That's it. That was all I was doing. I wasn't really doing anything significant for a patient. I never felt I was really helping them enough. But knowing what I do now, it really changes how I think of things. So what is the one last message you want to leave our audience with today?
Let me add something to what you just mentioned, and you mentioned it a few times today, and I didn't want to go there, but let's go there. I won't spend too much time, and I want to be clear. I am not saying that it's a conspiracy. I'm not saying that it is like on purpose, but we need to understand that the pharmaceutical establishment, these are businesses. A business needs to make money. It is the main aim of any drug development. It is to make money. In the world of medicine right now, if you have diabetes and I sell you insulin for every day of your life, for the rest of your life, that's an amazing business model. I can make a lot of profit on that. If something comes that can repair your pancreas, and after that, I don't have to sell you insulin, So as a pharmaceutical establishment, if I have a choice between something that cures you or something that I sell you all your life, the business momentum, I'm not talking about the doctor, I'm talking about the businessmen that are behind all of this. The momentum is not toward cure. The momentum is toward managing symptoms, increasing your quality of life for the rest of your life. The entire medicine has become a medicine of treating symptoms and increasing quality of life. There's not a whole lot of cure in medicine. Stem cell brings cure. And that is, I think, the biggest reason why it is such a clash. It is bringing something that right now in medicine is believed to be impossible. And yet it is. I am telling you, I have seen it in so many cases. The doctor that I'm working with, I've seen it. I have cases of quadriplegics getting mobility just by releasing their own stem cells. The spinal cord should not repair. You get a spinal cord injury, we teach you how to live with your deficiency. We cannot help you repair. Stem cells help repair. Studies are there. They have been published. They're on the scientific literature. I was talking to a neurologist many years ago. I was telling him, no, it can repair. If you want, I can. I was writing my book at the time. I told him, I can show you. I have the literature in my room. I can go in my trial room, get the literature. I'll show it to you. And he said, don't waste your time. What you're saying is stupid. The wall, it's a wall because they have not learned it in med school, then it cannot be true. And I am telling you, the science is there. The studies have been published. It is in the scientific literature. That's what I put in my book, Cracking the Stem Cell.
Okay, thank you, thank you, Christian. Guys, if you guys have been enjoying our conversation, be sure to subscribe to the channel because your subscribing to the channel actually helps us bring better guests to the show. Now, if you're considering a new career path, remember to check out our non-clinical pathfinder workshop on Disruptive Doctors website. And also be sure to come and join us for our annual Disruptive Doctors Conference this September 20th, September 2025, where like-minded doctors like you come together to share ideas that impact healthcare differently. Now that wraps up another episode of Post Call Beyond the White Coat. Until then, take care.
Join Disruptive Doctors. Oh, Disruptive